Pregnancy and gingivitis a lot of times go hand in hand. Thanks for joining me today. I'm Becky Moore with Restart Hygiene and Tea Talk. I want to talk to my pregnant ladies about their gums, their bodies, their babies, and how to be healthier and signs and symptoms to look for so you can improve your oral health for a lifetime. So let's first talk about what gingivitis is. Many of you have heard it, but do you know what it means? Gingivitis is a common form of gum disease characterized by inflammation of the gums. So when you get plaque on your teeth from bacteria and food and spit, it sticks to your teeth, and if not removed, it can irritate the gums. So it's stuck to your teeth, but it irritates the gums. Now, pregnancy gingivitis is a term that is meant for just pregnant women. Because of the hormonal changes occur in a woman's body, these fluctuations affect the gums, making them more susceptible and prone and sensitive to that bacteria and that biofilm, that plaque layer. This condition typically manifests in the second or third month of pregnancy. So the first month or first trimester, you're not going to notice as much as you will the second and third. So once that body gets baby going in there and gets the effects of pregnancy, that's when you're going to be more likely to notice it. Now, as you see on this model here, healthy gums are nice and pink, where gingivitis is really red, puffy, irritated, and tender. So that's what we want to talk about. Common signs of gingivitis include red, swollen, and tender gums. They bleed when you brush or floss, and they're just tender. They're just all out, just more sensitive. You also may see some gum recession or the feeling of loose teeth. Now, if that's the case, then you've actually started having a more serious problem coming on as periodontal disease, which can cause you to lose teeth. So make sure that we treat this, we see the signs and symptoms as early as we can so that we can prevent you from losing your teeth or having periodontitis, which is periodontal disease, which is the later effect of gingivitis. Now, let's discuss the pregnancy gingivitis on the unborn baby. So whatever bacteria are in your mouth, they do get below the gums. That's how the gingivitis happens. They get into your bloodstream. So now they're going to your heart and all throughout your body. So this bacteria we know as an oral systemic issue, the bacteria from the mother's mouth, if it's a lot of bacteria, can affect the baby by the bloodstream. So via the bloodstream, you have the baby being affected by your bacteria, believe it or not. These can affect your baby, the placenta, which is the nutrient part that the babies get the nutrients from and the blood flow from. So several problems have occurred that we know of habitually for mothers with a lot of gingivitis or periodontal disease that affects their baby. Number one is preterm deliveries. So you're having your baby earlier than you should. Now we know that you want to keep that baby in your womb for at least 38 to 40 weeks. Sometimes we keep it longer than that. So in order for the baby to be healthy and to grow naturally and to do what he or she needs to do so that they're born perfect, we want to make sure that the bacteria in the mouth are reduced so that the baby grows and comes on time at estimated delivery at the 40 weeks. So number two, low birth weight baby. We want to make sure that the baby weighs what he or she is supposed to weigh. So if the baby is not getting nutrients, it's getting bacteria, it can't get what it needs, he or she needs to grow, then that baby is not going to grow to be a nice 7-8 pound baby. So that's important too. And the third thing is preeclampsia. So that's the blood pressure. Babies are more likely to have more problems if the mother has problems with blood pressure. This can cause kidney and liver diseases for them or effects of that. So we want to make sure that we are eating well, that we are keeping the bacteria down to make the body as healthy as we can so that we can support a healthy pregnancy and a healthy baby. Now that we understand what gingivitis in general is, we understand what pregnancy gingivitis is, and we understand the effects on our baby, now what can we do to prevent that? Or if we have gingivitis, how can we reverse the signs of that? So let's talk about that. So number one, your dental hygienist is going to tell you, you got to brush and floss your teeth well. There's more than one way to skin a cat, so there's many ways that you can do this. Basic instructions, though, are always brush 2 minutes, 2 times a day with a fluoride toothpaste. So that could be a manual brush, that can be an electric brush. So either one you decide to use, but please use a toothbrush in your mouth, concentrating on brushing your teeth and gums for 2 minutes twice a day with fluoride toothpaste. Number 2, floss your teeth. Floss your teeth. So Floss has always been the gold standard with the string floss. I recently have realized how nice a water pick can clean your teeth. So it doesn't have to be with regular string floss anymore. It doesn't have to be. Anything you do between your teeth is going to help you and the baby. So floss with your fingers if you want to. Floss with a stick. You can use a water pick like we've talked about before. So a water pick. You can use a rubber tip. You can massage your gums with this, break apart the bacteria along the gum line, clean between the teeth some. That will help you as well. So anything you do can help you. All right, so remove the plaque and the food debris daily so that the gums don't have as much to get upset about, because they are hypersensitive when you're pregnant in that second and third trimester especially, and they will start showing rear their ugly heads. Number 2, visit your dentist. So your dentist, your hygienist, and even some of the dental insurances are now paying for an extra visit while you're pregnant. So that's awesome. If your insurance is going to cover it, well, please go and even if you don't have a bad case, at least go and have your teeth cleaned, have your teeth examined and your gums, and make sure that everything is going good. So check with your insurance if you have that. Eat a balanced diet. I'm a big hygienist that loves you to not only clean your teeth well, to drink your water, but to eat good food. So green leafy vegetables are good. Broccoli, spinach, good nuts are good. Dairy products are good. They provide a lot of calcium. Getting outside and get some sunshine. That helps your body with the vitamin D that processes the calcium. So that's important too. All right, and prenatal, most of you probably taken a prenatal vitamin. That is very important as well. All right, so manage stress. Manage stress. We do not realize how much stress can affect our gums through our whole lifetime, but especially when you're pregnant. So managing stress is very important. Taking a walk, resting, taking a nap, meditating, getting outside and get some sunshine. All these things can help your body de-stress, and if you're less stressed, your gums are going to be less inflamed, and that's the gingivitis. So gingivitis is basically inflammation, infection of the gums. Staying hydrated, drinking plenty of water. My middle son was born in September. About June, I went to the doctor, and I was not measuring right, and turns out I was hydrated. I need to drink water. As soon as I started drinking my water like I should, I plumped back up. My measurements were right, and everything was good. So I cannot not express how important it is to drink your water from somebody who did not, and she should have. So good sleep. This is one that goes under the radar. Your body needs good sleep your whole lifetime. What we're learning about more now is that we don't get good sleep always. Mouth breathing is a real issue. Clenching and grinding is an issue. Sometimes it's because of our nasal passages. Sometimes it's because our tonsils are too big. Sometimes it's just we're out of the habit. Our tongue's in the wrong spot. So good sleep is important for your body to oxygenate. It's important for you to make nitric oxide, and that helps with your supporting a healthy pregnancy, a healthy body, healthy baby. So that's very important. All right, I know it's a bit overwhelming. Being pregnant, you're trying to do everything right, especially I remember being pregnant the first time. I had to eat my vegetables on time, I had to do this, and I had to do that. And the second, third, it was not as stringent on my routines. But it is important that you do these things. Take these into account when you're making good choices. Of course, you're going to probably choose something like eat a French fry or cake or candy and indulge. But try to overall make good choices. Take your prenatal vitamins. De-stress, that's another one that we just don't think about all the time. And make sure you're not that you're getting enough good rest, good sleep. That's really important. So taking care of yourself and your baby is so very important. If there is a topic that we didn't talk about that you would like to hear more about, please put it down below. Like and subscribe. I'm just starting this channel out, and I want to serve your needs and answer your questions. So please help me to do that. Just let me know what I can do. So Becky Moore, Restart Hygiene, thank you for your time today, and thank you again. I appreciate it.